Thanks for joining. So my name is Mitch Lee, an emergency physician and founder of Take Medicine Back. We are hosting Peter Goodman tonight. We're concerned, of course, about corporatization of emergency medicine and medicine in general. But Peter Goodman is the global economics correspondent at the New York Times, and he just published the book, Davos Man, How Billionaires Devoured the World. He's a two-time winner of the Gerald Loeb, if I pronounce that correctly, Award for Distinguished Business and Financial Journalism. As the New York Times, a national economic correspondent, he played a leading role in the paper's award-winning coverage of the Great Recession, including a series that was a Pulitzer Prize finalist. Previously, he covered the internet bubble and bust in the Washington Post communications reporter and served as that paper's China-based Asian economics correspondent. And Peter just published this book, Davos Man, and it featured probably, I'll just call it a fifth of the book, the issue of American healthcare and how it has been essentially pillaged by private equity firms and the Davos Man. So we'll get started now. And Peter, I would just ask you essentially, what is a Davos Man? Because it's vague if you don't know what it is, and what motivated you to get started.
Yeah, well, first of all, Mitch, thanks so much for having this event, and thanks to everybody for joining. I'm not often in front of a group of people that clearly knows far more about the subject you're most interested in than I ever will, and so I welcome your input into how I should be seeing your issue, while we can talk about the broad context. So, what is a Davos Man? Well, Davos Man is a term coined by the political scientist Samuel Huntington back in 2004. He was using it to describe people who go to the World Economic Forum in Davos, Switzerland, which is this annual gathering of the most powerful, wealthiest people on earth. We're talking about the billionaire class, the CEOs of every major corporation you can imagine, heads of state, the odd celebrity. I'm using it as a somewhat playful way to look at the species of human. I think we have to look at them as a separate species from the rest of us, who have so much power and such complexity to their wealth that they employ lobbyists and tax accountants and lawyers the way most of us employ maybe people to clean our houses, if we're fortunate enough to be able to do that. And specifically, people who go to the forum and who help perpetuate this idea that when we organize our economies around delivering more wealth to the people who already have most of it, somehow everyone wins. Something that has in reality happened 0 times. When we perpetuate this idea of trickle down economics, if we cut taxes and we deregulate and we let billionaires do what they do, maximizing the bottom line for themselves, we'll all get the benefits. And we saw last year at the virtual meeting of the World Economic Forum, they couldn't actually meet in Davos because of the pandemic, but at the virtual meeting, one of my 5 primary characters, Mark Benioff, who's the CEO of a big tech company called Salesforce, literally said, CEOs are the heroes of the pandemic. This is, a story I've told in front of a lot of audiences, but this particular audience, I would think, would appreciate that more than most. He was not talking about frontline medical workers. He was not talking about, parents stuck at home doing their jobs while dealing with kids cooped up and attending to distance learning. Essential workers bringing us our food, people emptying bedpans in nursing homes. No, the CEOs, he said, are the heroes of the pandemic. And he said, they've delivered vaccines and finance that staved off bankruptcies. And we did it, he said, not for profit, but to save the world. And he specifically said, government didn't save you, non-governmental organizations didn't save you, we saved you. This, as I argue in the book, is this elaborate kind of prophylactic against the exercise of democracy, where we, the rest of humanity, has a say over the terms of our global capitalism, so more people could benefit. things like progressive taxation, rules for labor, some say over who gets vaccines, all of these sorts of machinations, basic exercise of democracy. Well, the billionaires will say, no, we've got this. We'll take care of all of life's problems. So that's the central idea, the central ideology, if you will, of Davos Man, is we can handle your problems left to our own devices. Therefore, you don't have to govern. You don't have to regulate.
Thanks, Peter. So that's the background there. And you mention essentially the cosmic lie in the book, or you don't mention it, you probably coined the term. And I'm wondering, right now in emergency medicine, we're confronting a big corporatization of our specialty and increasing consolidation, and more of those groups backed by private equity companies that include Schwarzman and Blackstone. And I feel like there's a defense within our own specialty, which I find hard to stomach. I don't know how it happens, but I feel like maybe there's some buying into the cosmic lie of, well, we need these groups in order to defend us from some other outside groups, being namely insurance companies, and that will help us out. And I feel like that's a little bit of trickle down economics. So what's your definition of the cosmic lie that society's fallen to?
I mean, the cosmic lie has many points to it, but the basic idea is that the billionaires are the good guys. The billionaires are the sources of innovation. The billionaires are the sources of forward thinking and human progress. So the more money they have, the more good they can do, and trickle down is a central part of that. And so what we end up with is a series of trade-offs, right? We always have money for tax cuts for billionaires, not just in the United States, but increasingly in places like Britain. I mean, my book is global. My book looks at situation in Italy, in Sweden, in France, to an extent in Germany. And we always seem to have money to finance more relief for billionaires because that's supposed to be the source of all of this progress. But we don't have money for things like basic healthcare. We don't have money for education, for infrastructure. That's the cosmic lie, that we've got to have austerity because we got to live, according to the sort of zero-sum calculation that governs the stuff that people actually seem to want. If you look at polls, but we're not. It's not a waste of money if we lavish more finance on billionaires. And this is, the central story of my book is this bottom-up systematic transfer of wealth, from everybody to a minuscule fraction of humanity. And the story that I'm telling in my book is that I mean, this part's familiar, right? We all know about inequality. I mean, you asked me before, why did I write the book? I mean, before the pandemic, I started out looking at the sources of these right-wing populist movements. I mean, I was living in London, I was writing about Brexit, which is this nativist response to stagnating living standards for most rank and file workers. I was writing about Trump and the Trump trade war, which of course is, it's many things, but it's in part a response to declining living standards for all sorts of people. And I was writing about the movement to the right in Italy and even in Sweden, the supposed bastion of social democracy, where, while I was there, the Sweden Democrats, a party literally founded in the neo-Nazi movement, went from, an absolute fringe operation to a mainstream party that polled third in national elections, in the middle of my writing this book. And what I discovered in each of these cases was that, on the surface, from Trump to Brexit to the Sweden Democrats, was this backlash to something. Usually it was immigration, the perception that outsiders were responsible for declining living standards. But that was a story that was pushed by self-interested, opportunistic politicos. And the story worked because of the thing that wasn't discussed, because of this systematic pillaging, really, by Davos Man, which had played out, so gradually as to be almost invisible, though it was in fact happening in plain view. I mean, essentially, billionaires used their wealth to finance lobbyists who rewrote tax codes who eliminated antitrust enforcement, and so they gained monopoly power, who defenestrated labor unions so they could keep more of their winnings for themselves, and who forged trade deals. And I don't demonize trade. I think trade is actually part of the solution, not the problem, but forged the sorts of trade deals that allowed them to undermine labor interests. And this was like the big story that was always beneath the immediate thing that captured the headlines, whether it was, the influx of immigrants in Sweden that then allowed the Sweden Democrats to claim that all of this taxpayer money was being wasted on people who would never work, to, Trump threatening to build the wall, actually building a wall on the border, demonizing immigrants, claiming that, Central American gangs were terrorizing communities that had never even seen such an incident. And so as part of, then the pandemic happens, and I realized that quickly that the pandemic is exposing the consequences of this inequality and worsening those consequences. And your part of the economy is but one, though obviously a centrally important part of the economy. And I spent a lot of time looking at the impact of private equity. I mean, people like Steve Schwarzman, who's one of the 5 primary characters in my book, worth $35 billion, who figures out that healthcare is where the money is. I mean, Americans in 2019 spent $3.8 trillion on healthcare. Steve Schwarzman wants in. He ponies up $6 billion for Team Health, and not by accident. I mean, Schwarzman had pioneered a very profitable way to vacuum up foreclosed properties after the great financial crisis, understanding that people who were renting homes who were of minimal means, they couldn't move and they couldn't protest if you cut their services. They were sort of stuck with you, so you could cut costs. They had nowhere to go. And I don't think it's an accident that Schwarzman ends up in emergency rooms of hospitals, because, let's face it, I don't have to tell you guys that a lot of the people who are coming in the door are not really in a state to ask probing questions about the details of their health insurance policies. They're going to sign on the bottom line to go see one of you so they can deal with their problems. And so Schwarzman is my primary character in terms of examining, how it is that the U.S. loses roughly a third of its hospital room capacity in the 3 decades before the pandemic, how it is that more and more healthcare professionals are having to think of patients coming in the door as customers, where revenue is to be maximized. I mean, Team Health actually starts paying people after Blackstone buys them according to revenue, essentially, while training people to seek out and document tests that will increase revenue. And it's obviously a complicated story, but it becomes at minimum a distraction. And I tell the story of Ming Lin. I don't know if Ming is actually on this call, but Ming Lin is a hero.
He
just joined. So, Ming Lin is a hero in this context, because here's a decorated emergency room physician who was right on the scene near the World Trade Center on 9/11, who is skilled at helping people who are in crisis, and who's working at a hospital in Bellingham, Washington, as the pandemic arrives in the United States. He's been following carefully what's been happening in Asia. His wife's from Taiwan. His parents are from Taiwan. He speaks Chinese and is able to listen to Chinese language media, and has a pretty sophisticated sense of what's ahead, and asks the perfectly reasonable question, why is it when the governor of Washington has already declared a state of emergency and there are COVID cases in Washington, and the U.S. has got, a couple months lead time, having seen what China's gone through, what Italy and Britain have gone through. Why are we greeting patients at a reception desk where nobody's wearing masks? Why are we, in fact, telling people to wear their own masks? Don't wear them because you're going to, upset the patients coming in the door. Why don't we have a triage system outside? Why don't we have social distancing inside? And he's asking these questions, and he's essentially told, the hospital's our client. You work for Team Health. It's part of Blackstone, and the hospital's the boss, and this is how they want to do it. And he says, well, why are we continuing to have people come in for elective surgeries as the pandemic is worsening? And there are clearly lots of cases, and we're worried about transmission. And he's thinking not just about his own people and the people in the hospital, but the whole society, a country of 300 million people. I mean, Washington's on the bleeding edge of the pandemic. And again, he's told, well, elective surgeries, that's the bread and butter. And we're working for our client, and that's the hospital. And so feeling that there's no other way and wanting to do the right thing, he takes to Facebook. And as I note in the book, like, he had been a very infrequent user of Facebook. He posted, a picture of his wife playing the violin. His profile picture was himself and his 3 kids in a swimming pool. He hadn't been an activist, no particular partisan line. And suddenly he started posting on Facebook that there's a real problem at this hospital, and people ought to be taking note that he's a whistleblower. And this goes on, and he's warned that he should knock this off, that he's causing embarrassment, that he's jeopardizing the revenue of the hospital, and he's eventually fired. And Blackstone tells me, no, he's not fired. He's in fact just moved elsewhere in the middle of a pandemic. A guy who is eminently capable of helping treat patients. No, he's just moved somewhere else. And, I think that this story is just so resonant. I mean, here is someone who has trained their whole career to attend to a society that needs healthcare in the middle of the worst pandemic in a century, and ultimately the business model that is built not with the interests of society in mind, but with the interests of the shareholders of a private equity company in mind. Their interests triumph, and this is a clear moment where the result is, I'm not saying Ming Lin could have stopped the pandemic, but a whole bunch of Ming Lins might have, and a system in which we are oriented toward public health and the societal interest, as opposed to, taking the incredibly critical work. I mean, it seems ridiculous that I even have to say such a thing. The critical work that you all do, which is increasingly subject to the same sorts of considerations that dictate, what does it cost to fly from New York to Los Angeles, or what's a cup of coffee cost you at Starbucks? It's really quite outrageous that these are the pressures that have been brought to bear on, I hesitate to use the word industry, but that's what it is. And I think Ming Lin's experience is deeply representative of that. Excuse me.
Thanks, Peter. You mentioned, or I say Davos Man is kind of a profiling of the Davos Man, which, if anyone missed it, is essentially the city where the World Economic Forum is held every year, and basically anyone who's anybody gathers and talks about how they're going to improve the world, and some of that is billionaires with maybe a messiah complex, thinking that they're going to save the world, and they'll say everything positive except maybe say that what their business model is doing is actually creating wealth concentration and poverty to the degrees this world's never seen before. The Davos Man probably have some kind of defense of their model, and the defense in emergency medicine is that, well, there's other exploitation, people who are exploiting the system, and that's insurance companies, and that's probably correct to some degree. So we need some other big group aside from that, to do battle with the insurance companies. Aside from that, what is the justification? And particularly, we're looking at private equity, the justification for the Davos Man that the general public might resonate with. Why do we need all this money or leveraged buyout debt in order to do medicine? Is there some defense of that at all, or not?
Well, it depends upon sort of where you start the story and how much of the Davos Man story you believe, right? Like if you, I mean, Davos Man is very skilled at giving us false binary choices. Like when you go to Davos and the World Economic Forum, like everything is about finding win-win solutions, right? There's this, I do spend a fair bit of time in the book looking at the operations of the forum itself. And I think it functions as a kind of breeding ground for Davos Man thought. And it's almost a place where Davos Man like rallies amongst himself, reminding himself that he's the good guy. I mean, I've been to Davos conversations, panel discussions, groups of CEOs of large pharmaceutical companies, including Gilead. I think this was back in like 2016, where an earnest moderator from CNBC asked, why are drug prices so unaffordable, and what can we do about that? And Davos, by the way, gathers under this mantra, committed to improving the state of the world, which is an incredibly ironic rallying cry, given that the people who go to Davos are by any reasonable measure, the primary beneficiaries of the status quo. But it serves this purpose that if you're there, if you have a seat at the table, then you must be, earnestly trying to improve the state of the world. So you can have this spectacle of drug company executives opining, well, it must be that we haven't found the right models yet. Or, maybe we just need to have more multi-stakeholder dialogues toward finding the right tweaks that will make drugs, more affordable. I mean, let's get real. Drug prices aren't affordable because pharmaceutical companies are controlled by publicly traded corporations that employ executives who have a fiduciary responsibility to maximize returns for shareholders. And that means pricing those drugs as high as they possibly can on the supply demand curve to maximize the revenue. And if the result, it's not an accident that COVID vaccines are widely available in wealthy countries whose governments can pay whatever Pfizer and Moderna want for those vaccines, while the bulk of humanity has no protection whatsoever. That is the system that we actually live in. So, to come back to, your question, like, should we view private equity in your sphere of emergency medicine as a proper check on the ecstasies of insurance companies? Well, sure. If you start with the supposition that the healthcare system that we've got in the United States and our model is just somehow like that's the one that's preordained and best, even though most of the rest of the developed world has some form of national healthcare, either single payer or some insurance model where, I mean, we don't have to get deep in the weeds of various models around the globe, but, the US is an outlier to have a system where we have 30 some odd million people with no healthcare whatsoever, and where people have to go to emergency rooms when they're really in need, because that's the only place they can go, and they've put off any kind of preventative care because they don't have coverage. Now, why do we have this system? Well, in part because of this false binary that Davos Man has managed to insinuate into our political discourse, that we just can't afford anything. Now, why can't we afford anything? Why can't we afford something? Well, why do we have these absurd conversations about the supposed impossibility of having national health care in America when every other developed democracy seems to figure out how to do it? Well, the biggest difference between the United States and every other developed democracy is we don't tax wealthy people. I mean, we are living in a country where people like Steve Schwarzman, worth $35 billion, Jeff Bezos, who, depending upon the value of Amazon shares on any given day, is worth between $150 billion and $200 billion. These are people who are paying a smaller slice of their income and wealth to the federal government in the form of taxes than the people who are scrubbing the toilets at their multiple residences. That's why we can't afford some form of national health care. And that's why we've got this system, this cockamamie system that no one would design as somehow optimizing societal good, but that is a product of various special interests manipulating our democratic process to protect whatever stake they've got. And so, yes, if you start with that's where it is, then I certainly do see the argument that private equity big, powerful, able to look out for its own interests, is a counterbalance against the abuses of insurance companies, who, so far as I can tell, provide no benefit to anyone whatsoever, and are classic middlemen who just get a piece of the dollars that we're spending on healthcare. But the result of that, I certainly don't have to tell you, is that we're living in a country where we spend way more on healthcare than any other country for often less than optimal outcomes. And that is a problem that stems directly from the saturation of our political discourse by this idea that Davos Man is very skilled at trotting out there, which is, we've got to have a small government, we've got to deregulate, we've got to have low taxes, which is just an elaborate way of saying, give me more money.
Yeah, I actually, something that really struck me in your book, in contrast with talking with some emergency physicians across the political spectrum, is how nonpartisan your criticisms are. Where you criticized Donald Trump as much as Bill Clinton, and I think that's something that is divisive, and as you mentioned, gives fuel or oxygen to the fire of conspiracy theories and strongmen, is that there is so much inequity. Like, we all sense it, and most people don't think physicians are in that world of inequity, but we're now feeling that ourselves, and we're seeing our patients exploited, and then all of this exploitation demands some kind of a explanation, and sometimes QAnon or another conspiracy theory is just the easiest way to connect the dots. Before we move on to just like questions within emergency medicine, I'm curious what your thoughts are now, because you bring it all the way up to current events with Biden, who just had his State of the Union address last night, and of course we've had an attack on democracy with Ukraine. Right. There are certainly some factions of the United States who are defending what Putin has been doing, because they are looking at the new world order as maybe a bad thing, and there's some truth to that, because it sounds like Davos Man essentially exploited peacetime efforts post Cold War, which we're basically just repeating it right now. So a little commentary on the current political situation, how post Cold War maybe democracy is the answer, but it also was exploited, and here we are with Davos Man. Before we open it up to comments.
Well, I mean, I think your point about this bizarre admiration for Putin, is reflective of the fact that democracy has really been debased. I mean, if you go back to the fall of the Berlin Wall, and it was absurd at the time, but it wasn't crazy. This idea that Francis Fukuyama pushed, that this was the end of history, that American style liberal democracy was the template for the globe, and everything was really just details, but we were at the end of the story of humanity trying to figure out how to govern itself. And then you look at where we are now, where democracy has essentially been weaponized against itself. And it's a means of tribal warfare, right? I mean, Viktor Orban in Hungary actually uses democratic means to just repress, tyrannize the minority. I mean, Bolsonaro in Brazil. I mean, certainly Trump, however you feel about Trump, he tells you himself, he's not much into the niceties of due process. I mean, this is somebody who very openly admires those who have authoritarian powers, like Xi Jinping and Vladimir Putin. And part of, my book tells the story of how that happened. And essentially what happened is we took economic systems that were pretty good at the old, rising tide lifts all boats. Post World War II, we had several decades during which that cliche really was true. And the billionaire class remade the rules, rewrote the tax code, got out from under antitrust enforcement, and undermined labor. And the result of that is a lot of wealth that should properly have flowed to the populace writ large, flowed into a very select set of hands. And the consequences of that, I don't think can be overstated. I mean, one of the key consequences is a lack of faith, a loss of faith in anything that's elite. And that has opened the door to all sorts of political opportunists offering all kinds of cockamamie explanations and absurd conspiratorial ideas, terrible prescriptions in response to very real problems. So people are not crazy in the US or Britain or Italy or many other societies to have concluded from the last several decades that their needs, their abilities to support their families at a middle-class standard don't really amount to much in the calculations of the people who are running our economies. And so that creates the opportunity to tell absurd stories, whether you're talking about QAnon or again, Central American gangs. I mean, I do think you can draw maybe a curving line from this pillaging of our economic systems, the monopolization of the bounty of global capitalism by a handful of people, and you can get to an explanation of why is it that in the wealthiest country on earth, the country that actually developed the two most effective vaccines in record time against COVID, you have huge numbers of people who have concluded that the vaccines are part of a conspiracy and they're not in, and this is partially what's perpetuated the pandemic. Why do we have the January 6th insurrection at the Capitol? In part because of this. And you have to look at the performance of liberal democracy during the pandemic and ask, if we can't marshal the resources to solve this, if we can't both distribute the capacity to produce vaccines around the world and get vaccines into the bloodstream so that we can stave off, Delta, Omicron, whatever next letter of the Greek alphabet we're all at risk of learning through another variant, how are we going to tackle, even more complex challenges like climate change? I mean, if the average person can legitimately conclude that the billionaires are not willing to sacrifice, I mean, they're not willing to pay taxes at anything close to the rates at which, people have paid taxes in America for decades previous, then how do we tell a coal miner in West Virginia, sorry, pal, you're part of history. We need you to transition to some other form of livelihood, when that coal miner has every right to say, well, who's going to take care of my family? Where's my help going to come? How am I going to send my kid to college? Who's going to pay my mortgage or my rent? If we are in a time where the lived experience of people in our society is, I'm not going to be taken care of, and this looks like a ruse, and it looks like the system's rigged, that it's very difficult to have conversations about really any aspect of governance. And I do think that the pandemic and the low rates of vaccine in the States, like, it really brings that home.
Thanks, Peter. I'm going to stop recording now and just open it up to questions.